During pregnancy, even simple activities like getting in and out of bed require significant attention and care. This is because during this period, easy movements like these can place additional pressure on your abdominal muscles and pelvic floor, which are already weakened and stretched. Think of these muscles as an elastic band that functions like a corset, wrapping from your ribcage all the way down to the back of your pelvis. They're essential for stabilizing your trunk, supporting your internal organs, and even assisting in the birthing process. Before we dive into these crucial techniques, make sure to hit that subscribe button and turn on notifications so you get all our pregnancy and postpartum care tips. This information could make a huge difference in your recovery, so don't miss out. Now let's continue. Before pregnancy, this elastic band was firm and strong. But during gestation, it begins to stretch considerably to accommodate the increasing size and weight of your growing baby. As these muscles stretch, they naturally weaken somewhat. And when this weakening happens, even simple everyday movements can place extra pressure on this already stretched band. This can lead to serious postpartum complications, such as pelvic organ prolapse, diastasis recti or abdominal separation, urinary incontinence, or even persistent lower back and pelvic pain that can affect your quality of life. Unfortunately, it's not just the way you get in and out of bed that places additional pressure on these vulnerable muscles. Everyday actions like lifting a toddler, carrying groceries, bending down to pick something up off the floor, as well as how you stand and sit throughout the day, can all amplify these risks significantly if you use the wrong technique. Now, exercises and movements like these aren't my primary area of expertise. This is something a specialized physiotherapist or physical therapist is much more qualified to cover comprehensively. But I think this is really important, crucial information that every pregnant woman needs to know. So I brought in experienced physical therapist Megan Stevenson to guide you through a series of essential changes to make to your daily activities throughout your pregnancy to help minimize the risk and severity of these postpartum issues. So over to Megan, starting with the proper technique for how to get into and out of bed safely during pregnancy. Typically, when you're not pregnant, we all tend to leap into bed without much thought. So what that normally looks like is we sit casually on the edge of the bed, swing our legs in quickly, and then lay back down. To get out, we do the opposite movement, which is essentially a crunch-style maneuver, swinging our legs over the side and then sitting up on the edge. As your pregnancy progresses through the trimesters, it gets increasingly harder and harder to use your abdominal muscles correctly and safely, as the growing weight and load of your expanding uterus puts extra pressure within your abdominal wall. So that you're not adding unnecessary extra load or tension through the abdominal wall and pelvic floor, a simple thing you can do when getting in and out of bed is learn how to log roll properly. So you sit on the edge of the bed, making sure you're sitting back far enough so that the bed is positioned behind your knees. You want to drop down sideways onto your elbow as your legs swing up together simultaneously, and then gently roll onto your back from that side-lying position. To get out of bed safely, it's the opposite sequence. So you want to roll onto your side first. As your legs swing off the edge of the bed, you press up through both hands equally, making absolutely sure that your shoulders and your pelvis stay in proper alignment throughout the movement. The next area to pay close attention to is how you sit throughout the day. Adopting a proper sitting posture during pregnancy can greatly influence your overall comfort, energy levels, and prevent pain. However, when we're pregnant, we often unconsciously default to one of two problematic postures, both of which can cause significant discomfort and problems. The first position that pregnant women commonly adopt is perching on the edge of the seat. What this does is help create space for the growing belly. However, it does encourage that increasing curve in the lower back, creating excessive lumbar lordosis. What this excessive arch does is increase the tension through the abdominal wall and the pelvic floor muscles. This position can also put a lot of uncomfortable pressure through the front of the pelvis, specifically the pubic symphysis, where many pregnant women experience pain as their pregnancy progresses. The second problematic position is slumping back in the chair. So what happens here is there isn't enough proper support within the chair to support the natural curve of the lower back, which causes the pelvis to rock backwards into what we call a posterior tilt. By tilting the pelvis backwards in this way, this can place extra unnecessary pressure through the abdominal wall and the pelvic floor. It also can create pain and discomfort within the lower back as it's held in that excessively curved position for extended periods. This slumped position can also negatively impact the baby's position as they go head down into the birth canal to prepare for labor and delivery. During pregnancy, the easiest way to make sure that you maintain good, healthy posture while sitting is to make sure that you sit all the way back in the chair, so your bottom is against the backrest, and ensure that your hips are positioned slightly higher than your knees. You can use something like a small towel rolled up to place behind the lower back to support and protect the natural curve. And then if you still find that you're not quite sitting in the right position, that your pelvis is still rocking forward or rocking backwards, place your hand underneath your bottom and gently separate your sitting bones. And it just helps you sit right on top of those sit bones properly, making sure that there's length through the crown of your head and you're nice and open through the collarbones and chest. While we're on the important topic of posture, another posture that changes significantly during pregnancy and requires some careful tweaking is your standing posture throughout the day. Typically during pregnancy, your standing posture can shift in one of two problematic directions. The first one is you can lead with your belly, rocking your pelvis forward into an anterior tilt. The second being you can rock the pelvis backwards, tucking your tailbone under into a posterior tilt. Both of these positions add additional unnecessary load and tension through the abdominal wall and pelvic floor muscles. So to avoid this additional load and protect your body, it's important you learn how to stand with your pelvis in a neutral, balanced position. Now this can be a little tricky to find initially, so I'm going to carefully step you through exactly how to do it properly. Firstly, you want to make sure that your feet are positioned directly under your hips at hip width apart, and you want to unlock your knees, keeping them soft. From there, you want to rock the pelvis backwards and forwards slowly, and you will feel these two extreme movements at each end. You want to stop in the middle between these two extremes. This is your neutral pelvic alignment position. From there, you want to make sure that your ribs are stacked directly over your hips, shoulders melting down the spine, and nice and long through the crown of your head toward the ceiling. Now let's cover the small but important tweaks you can make during your pregnancy when lifting objects, from small toys to heavier things like grocery bags. It all starts with the proper rhythm of your breath, which is crucial. When picking up any load, for example, your toddler or some grocery bags, it's really important that you exhale when you exert force. When you exhale properly, what happens is that exhale breath helps activate the pelvic floor and your lower abdominals, specifically your transverse abdominis, helping them cope with that increase in intra-abdominal pressure that the load creates within the abdominal wall. So let's go through exactly how you would pick up some grocery bags safely. So the first thing you want to do is split your stance, placing one foot in front of the other. Maintain a nice neutral spine as you inhale and bend at the knees. Then exhale firmly. Come up into standing, maintaining that neutral spine throughout. If the load is quite heavy, you may find that you have to go lower, bringing the load towards your center as close to your body as you possibly can. And again, exhaling to come back up into standing. To put the load back down, it's the same thing in that you want to maintain your split stance. Keep your neutral spine position, and then inhale as you go down. Exhale back up to standing. Now, if this isn't your first child, you might also need to lift a toddler frequently during your pregnancy. And this type of lift comes with additional challenges that you need to account for and plan for. Usually when you go to pick up your toddler, you do it the quickest way possible without thinking, which is to come down, bend only at the hips, reach forward, and pull them from the ground, and come up into standing. So as you do that rapid movement, what happens is there's a lot of downward pressure going through the abdominal wall, usually concentrated at the belly button area, which is the weakest point, especially during pregnancy. So to pick up your baby or your toddler correctly and safely, it's similar to what we did with the grocery bags, in that you want to approach with the split stance. Bend at the knees properly, inhale down, bring the baby close to your center, and then exhale, standing up nice and tall with engagement through your core. And then to put them back down on the ground, it's the reverse sequence. So keeping the split leg stance, coming down controlled, and you exhale on the way down. Place the baby down gently on the floor. Again, exhaling to come back up nice and tall to standing. During pregnancy, aside from lifting your toddler properly, the way you carry them throughout the day can also significantly impact your posture and overall comfort. Typically, when holding a toddler, you tend to hold them on your hip, which makes the weight shift dramatically to one side of the body, pulling unevenly through the abdominal wall. This could increase the risk and the severity of your abdominal muscles separating, worsening diastasis recti. To minimize this risk, you want to hold your toddler in the center of your body whenever possible. This will encourage even weight bearing through both legs, which will make sure the load is distributed evenly through the abdominal wall and the pelvic floor. Another thing that can happen is the pelvis can tilt backwards, which creates this locking of the knees and an increasing pressure within that abdominal wall. So you want to still maintain a neutral spine while you're holding the toddler, and this may mean that you have to rock your pelvis backwards and forwards slightly to find that center of gravity and balance point. In addition to carrying your toddler, you may also find yourself pushing them around in a stroller or pram throughout the day, and this can put additional stress on your abdominals and pelvic floor muscles. So it's important to be mindful of how you push it to protect those vulnerable muscles, and you can do this by making 2 simple adjustments to your technique. The first thing you need to do is adjust the handlebars on the stroller to the correct height for your body. So you want to make sure that your elbows are bent at approximately a 90-degree angle, and this will ensure that you're pushing the load of the stroller and the baby with your core muscles and leg muscles rather than straining your upper body and shoulders. The second thing you need to do is make sure that you are stepping into the frame of the stroller as you are pushing it forward. What this will do is ensure that you're using your strong core and your legs to push the stroller rather than relying on the upper body alone. If you don't do this, what tends to happen is the stroller will get too far in front of you. And what this does is increase that tension within the abdominal wall and thus your pelvic floor unnecessarily. Modifying the way you do everyday things during pregnancy is really important for all the reasons I mentioned earlier in the video, including preventing diastasis recti, pelvic floor dysfunction, and chronic pain. But another really effective way to protect your body and significantly reduce the risk of post-birth complications is through appropriate, targeted exercise. Regular, pregnancy-safe exercise can prepare your body for the physical demands of childbirth and also help dramatically with your postpartum recovery. It can help alleviate common back pain and pelvic pain, strengthen your muscles and joints to better support the added weight of pregnancy, enhance your overall fitness and stamina, prevent excessive weight gain, and even reduce the risk of certain pregnancy complications like gestational diabetes, as well as provide tremendous benefits to your mental health and emotional well-being. Maintaining a strengthened core and pelvic floor during pregnancy is extremely important and helps in many aspects, including preventing back pain, facilitating an easier labor and delivery, and improving your postpartum recovery significantly. I have more videos on safe pregnancy exercises and core strengthening routines that are suitable for every trimester, so make sure you check those out. If you found this video helpful, please hit that like button, share it with other pregnant mamas who need this information, and subscribe to the channel for more evidence-based pregnancy and postpartum tips. Your body is doing amazing work growing a baby, so give it the care and attention it deserves. See you in the next video.